first step in sanitary technique protocols is the introduction to greeting the customer. I like to keep my mask present and on my body so the customer can see it. The first thing you do is you knock on the door and then walk 6 feet away. Make sure that your sanitary supplies are present so that the customer sees, the presentation that you have here, that you're serious about sanitary protocols and feel more comfortable. So the first thing I'll do is I'll knock on the door. No gloves, no problem. I'll step 6 feet away and get ready to greet the customer. Now that I've knocked on the door and stepped 6 feet away or greater, the customer has opened the door and is talking to me. We have an imaginary customer due to being in quarantine, but you can bear with us. So now, after the customer greets us and talks to us, we will start to put on our mask, booties, and step 1 gloves. Now that I have my mask, booties, and gloves on, I'm going to enter the home immediately with my sanitary supplies only. The reason for this is you want to have an area to set up your sanitary supplies to sanitize things in case you make any mistakes while doing the procedure. We all make mistakes, so it's good to have a backup. Immediately set up your sanitation supply area in the home. What I do is I put down a drop cloth or a paper towel, anywhere you like, and then put your paper towels and sanitation supplies on that paper towel. Now you're going to be setting up your sanitary barrier. This is going to be a disposable plastic or reusable sanitized tarp barrier that goes, on the surface of the home in your work area. On top of that surface, you're going to be putting your regular drop cloth. This is going to be more heavy duty to handle dirt like you would do business as usual. So first thing you do is take the disposable, cut it, put it in your work area to set up your sanitary barrier. Now that I set up my sanitary barrier, my work drop cloth, and my work tool area, I'm pretty much ready to get started using my step 2 work gloves. While I set up the sanitary barrier, I'm in a very confined space. I'm in a row home in South Philadelphia. That happens all the time. So I still gave myself enough room to have an overlap with my sanitary plastic barrier, in my work drop cloth. The purpose of the sanitary barrier is to reduce the number of transient microorganisms on the inanimate work objects that you have that are unsanitary. That's a very important factor. While you're setting up, everything isn't perfect. Remember, you're touching the wall outlet after touching one of your pieces of equipment that is unsanitary. But at the end of the day, you're still reducing the total number of microorganisms by wearing your step 1 gloves, and then you're going to be sanitizing these things afterwards. Now I'm going to be getting ready to take off my step 1 gloves and put on my step 2 gloves. First thing I do is I pinch the outside of the glove to remove it. As I do that, I pull it off and I hold it in my one hand, okay? The next thing I do is I reach to the inside of my second glove and I pull it off like so. Now all of the microorganisms that may have been on inanimate objects in the home, as well as my equipment, are now contained inside these gloves. Now I can put on my work gloves. I can be less sanitary in this process and do business as usual. I can touch my body, I can touch whatever I want, because we're going to be putting on a whole new set of step 3 sanitary gloves once I'm done my work. After performing the work, once all of my work tools are now collected up using my step 2 gloves, I'm going to move on to my step 3 gloves. The reason I like to collect all of my tools first using the step 2 gloves is my tools are going to be pretty dirty. They're going to have a lot of microorganisms on them, and it would make sense to get it as collected as possible before putting on the step 3 gloves that you're going to touch door handles with, you're going to interact with the customer with. So that's really important. I'm relatively gathered up. Now I'm going to be taking off my work gloves. I'll probably put them in this bag, and then I'm going to be working on putting on my step 3 gloves using the process to put gloves on, holding the inside of the glove, putting it on, and then holding the exterior of the second glove, putting it on, readjusting my gloves to make sure they're in good shape. Now that my work tools are out of here, I've now put on my step 3 gloves. I'm going to be taking up my disposable sanitary barrier, preferably touching it on the this contact side that came in contact with the home versus the side that came in contact with my tools and my transient microorganisms. I'm going to clean all this up real quick. Once this is cleaned up, I'm going to be grabbing my cleaning solution to disinfect all the inanimate objects that I came in contact with. A good example of sanitizing all the surfaces that I may come in contact with would be the wall outlet. That's very important. A lot of customers will touch the wall outlet much sooner than they touch the top of your fireplace. So I'm going to grab my cloth, spray a little disinfectant on here, whatever CDC guidelines recommend depending on the outbreak. I'm going to hit this wall outlet, use a little bit of force to move the majority of the glitter and butter, and then allow that to sit and saturate with a long 3, 5, 10 minute exposure time, whatever is required as it evaporates off. I'm going to come and I'm going to wipe down the entire fireplace. Some fireplaces have remotes. I'm going to be sanitizing that remote just like I sanitized the wall, and just checking all the door handles, making sure they're sanitized when I come in and I come out. Before I sanitize the door handles, I have to make sure that I finish my customer interaction. So if I need to write a receipt, a digital receipt, I'm going to do that first. Okay, we're going to be going over customer interactions just really quickly. So you want to stay 6 foot apart from your customer inside the home according to CDC guidelines as best you can. That's not always easy, but you should definitely try, and sometimes it helps, you know, to remind the customer that you're going to be staying 6 feet away from them for their safety and yours. You're going to try to have a paperless transaction. So hopefully the person on the phone, before you even got there, try to set that up to promote that. They could either pay by email, which would be really helpful. They could call in and pay, that would be really helpful. But if it has to be a transaction in person, like they really want it to be a check, I would recommend having a plastic sandwich bags that you had for each individual customer. So they could put it into the plastic sandwich bag, and then you could take that back to the office. If it has to be a credit card transaction in the field, I would recommend having them hold the credit card and then typing it into the processing. There's an area when you have to sign for the credit card. You could ask permission of the customer to see if you could just sign a line for them. That's what I would recommend at this time during this particular outbreak. If your customer wants to sign your phone for the transaction, my recommendation is to, spray something on your paper towel to wipe down the phone. Make sure it's completely saturated. Give it the total exposure time that it needs according to that particular disinfectant, and then allow the individual to sign your phone once with you holding the phone. I know that kind of defeats the 6 foot apart rule, but you don't want the customer touching your phone beyond that. Then what you could do once they're finished with your phone, you can then swipe your phone as best you can, make sure it's completely with a very saturated cloth, and then allow it to get some exposure time before you put it back in your pocket or something like that. So once that's done, you can then get ready to leave the home. All of your supplies are now outside. They can be in the doorstep, they can be at the vehicle at this time. Now all you have on you are your gloves, your booties, your mask, and your disinfectant and your disinfectant wipes and things of that nature. So I'm going to get ready now to leave the home. First thing I'm going to do is I'm going to pick this up. I'm going to make sure that I really saturate this as best I can. The reason I'm saturating it is because when I go to sanitize this door handle, I'm using force to remove the butter and get rid of as much glitter as I can. But then I want this thing to be really wet so that it can get as much exposure time as allotted. The reason that I'm not spraying this is because I have all these home possessions everywhere. Okay, so if I just wanted to spray this door handle, I could end up getting some different solvents or cleaning solutions that could stain a lot of these items. So I'm trying my best to give it the best exposure time by really saturating the door handle and the knob and everything that I touched. But I'm not going to be spraying it in the home due to these other inanimate objects that could potentially be stained. So I'm going to do that to this particular handle. Make sure I'm not missing anything, like if I had paper towels or something like that. Make sure they're outside. I'm going to wet this up a little more. Put it out. And really wipe this thing down, giving it a lot of force. and then making sure that it's pretty saturated so it gets a nice exposure time where the disinfectant is able to slowly evaporate off over a 3 or 5 or 10 minute period, whatever it needs. Once you're outside of the home and you've already sanitized all of the door handles properly, now you have one of the most important things to do in order to protect yourself. Take your mask and gloves off in the proper order. So the first thing you're going to do is take your gloves off before you touch your mask. You're going to pinch the outside of the glove. You're going to pull it off. It's going to be in your hand. You're going to try to get the inside of the glove. You're going to pull it off. Now all of the microorganisms that were on your gloves are now contained inside here. Okay? I'm going to throw this out. I'm going to put it down right here for now. And now you're going to be taking off your mask. If you did this in the reverse order, you would be touching your face with transient microorganisms from the home. Now you can take all your supplies out as planned. Remember, the purpose is to reduce the total number of microorganisms. There are many instances when you're in the home where you're doing minor cross-contaminating, okay? You saw me put my phone back in my pocket, things like that. The key is to use a combination of disinfectants and minimized exposure to prevent any disease outbreaks. Thank you.